Hey everyone, my name is Kelly Welsh. I am a renal dietitian for approximately 25 years, as well as the Re.Nu Program coordinator. I have had PKD, been diagnosed for about 25 years, the same time.
I'm Thomas Weimbs. I'm a professor at the University of California in Santa Barbara in the Department of Molecular, Cellular, and Developmental Biology. My research lab has been focused on polycystic kidney disease for over 20 years. I'm also one of the founders at Santa Barbara Nutrients that makes product that's based off of the research we made in my lab.
So for those people who maybe have been recently diagnosed, how would you explain PKD and how it affects the body in the most simplest form?
Yeah, sure. So PKD, polycystic kidney disease, it's a genetic disease. So it's not something one catches, it's not infectious or anything like that. So everyone with PKD is born with it. And it affects primarily the kidneys, but also other organs. So it's really a multi-organ disease. But, the biggest problem clinically for most patients is really the progression of the kidneys towards chronic kidney disease and eventually end-stage renal disease, meaning kidney failure. The kidney disease progresses very different from one patient to another, even within the same family where everybody has the same gene mutation. There can be huge differences from one generation to another and one individual to another, how fast patients will progress. Maybe to emphasize, PKD is not a death sentence or anything like that at all. There are significant problems that come up, but that doesn't mean life is over or anything like this. So if somebody is newly diagnosed, and I see this very often, of course they freak out, especially if they might have seen a parent go through it and so on, grandparent and so on. There are certainly things one can do about it, and I'm sure we'll talk some more about all that. I think one has to take care of themselves to make sure you don't want to worsen the disease, you don't want to accelerate the progression of the disease, you don't want to be one of the examples of very fast progression of the disease. You want to be the slow progressor, which means, you want to die of old age, very, very old age, with kidneys still working fine, and ideally having very few extra renal outside of the kidney complications along the way as well.
That's most definitely the goal, which again is why we encourage people, everybody that comes into the Re.Nu program or that decides to adapt a ketogenic diet is in different stages of their kidney disease. I mean, they come in with lower GFRs, they come in with greater than 100 GFRs. And I always encourage those at any stage. The earlier that you can start making these dietary changes and lifestyle changes, the better chance of you have of really maintaining that function and maintaining health. So talking about the common symptoms of PKD, for a lot of people, they don't even know they have PKD until they have lost a considerable amount of function. Now, I guess speaking of myself, being a little bit lucky in that going for my first job out of college physical, they discovered I had high blood pressure, which maybe I would have never discovered because who would have thought a 21-year-old had high blood pressure? But are there other symptoms outside of elevated blood pressure that might occur to give you kind of a sign if PKD is in your family that maybe I should be looking into this a little bit further?
Well, usually, something like 85% of people with PKD have the family history. So they would already sort of expect, that they might have a 50% chance, if one of their parents had PKD, they would know, there's a 50% chance they might have inherited the gene, which means then you know what to look for. A doctor can diagnose this. That's usually often done first, even with an ultrasound, for example. It's a little bit different for people that get hit out of the blue, so to speak, where they are kind of the first in a family. There's always a first, and that affects something like 15% or so of the cases where there's just no family history. In those cases, sometimes it's just diagnosed randomly. Like you said, somebody has high blood pressure or somebody has some kind of a CT scan for some other reason. That happens all the time. And it can be caught even late stage, for example. I think every patient's journey is a little bit different. Sometimes hypertension actually tends to be an early symptom. So that's definitely something to look out for. Sometimes patients that have progressed already further have pain, and that might be one of the symptoms that leads them to go to a doctor and have them checked out.
You kind of mentioned this a little bit about PKD progressing over time. There's no real textbook. There's no real absolute formulary that tells you how you're going to progress in general. But what are some of the traditional current treatment options for PKD?
For most cases, I think PKD is managed pharmacologically, or the symptoms are managed. The hypertension is managed by antihypertensive medication and so on. So the only drug that is specifically actually approved for PKD is a drug called Tolvaptan, sold under the brand name of Q, which has been shown in clinical trials to slow the progression of PKD. So it does not stop it, let alone reverse anything. It slows the progression, which is better than nothing, obviously. Right? So before Tolvaptan, there was just no drug available. It's not necessarily available for everyone because there's kind of stringent criteria who can get it, who cannot get it. It's extremely expensive, so some health insurances may not pay for it, and it may not be available, outside of rich countries, if you will, for sure not. So it's not the perfect solution. So it's not that we can stop all the research, because there's one drug available. Far from it. So, and that's kind of what motivates us, for example, to come up with some much better solutions. All right. So Kelly, you're a renal dietitian. You run the Re.Nu Program. How can people that are interested in working with you or being part of the Re.Nu Program, how can they find you? Where can they find more information?
So Re.Nu has its own website, which you can find more information there. Sign up for the next program or sign up for a free call to talk with me to decide if the Re.Nu program is right for you, if you have further different questions, things like that. Also find us on our PKD Nutrition with Re.Nu and Santa Barbara Nutrients on Facebook page. You can see me and some other Re.Nu dietitians as well as Dr. Weimbs on that page and contributing. It's a great tool for education. All right. And Thomas, it is always lovely to talk with you, pick your brain. I know that I speak for all the PKD patients out there that we appreciate so very much the research that you do. Where can people find you? Where can people find your research?
I mean, one popular way of staying up to date with our research and everything that's going on is to join my lab's Facebook group. Just type in Weimbs Lab, search for that. Anyone is welcome to join. You can also head over to the Santa Barbara Nutrients website. There's a lot of resources and information there. I highly recommend the Santa Barbara Nutrients YouTube channel, where there's a lot of content there as well.